back to Good Day Big Bear. I'm John Wells. This is,
No blank.
and we have on with us this segment Mr. Ray Hino.
Good morning, John.
Good morning, Ray. Nice to see you.
And good morning, Noel.
Good morning. How are you doing?
I'm doing great. Glad to be here.
You got a big job, and it's a wonderful hospital.
Well, thank you, Noel. I appreciate it. It is a wonderful hospital. I'm very proud to be a part of it.
Very good. And we'll talk more about that in a second. I do want to give you a quick reminder. The 25th annual Seniors Luncheon hosted by the Rotary Club is taking place on December 4th from 11 to 2. And to get your tickets, you need to stop by the Senior Center. And you do have to pick them up in person. I guess they had people ordering like 20 tickets and only 4 people showed up or something. So stop by the Senior Center now. Do it now. They go quick. And again, that's the 25th Annual Senior Luncheon on December 4th from 11 to 2. And to find out about most everything else, pick up a copy of the Big Bear today. They're all over town for all the events and what's happening in town, except for this one.
Well, okay, thank you, John. I appreciate that. I want to invite all of your viewers to a special fundraising event that the hospital is having next week on Wednesday, November 20th, at one of your sponsors, the Old Country Inn.
Oh, very good.
Is going to be helping out the hospital with an all-you-can-eat spaghetti dinner beginning at 12 noon on Wednesday, November 20th, going till 9 o'clock p.m. at night. So come for lunch and dinner.
There you go. So this is at OCI?
It is at OCI, and it is a fundraising event for the new clinic building at the hospital.
Oh, very
And
good.
as your viewers may have noticed, that new clinic building, the Brenda Boss Family Resource Center,
Right.
is nearing completion, should be open within the next couple of weeks, and our staff has decided to, with the help of Old Country Inn, is doing a fundraising event to raise money for the new clinic building.
Oh, very good, very good. Now, Noel, have you seen the Brenda Boss building?
It's amazing what's going. You know, even the old building is wonderful. I took a tour of the hospital just recently, and it's an amazing place compared to other small towns. This is probably the best hospital I've seen in any small town.
And we're going through some transitions, hopefully to make it even better, and to
Yes.
enhance our ability to stay alive.
Yes.
I don't mean that personally. I meant the hospital financially, because hospitals are having a hard time all over the place.
They are. What's happening at the local hospital here is happening to every hospital in the country. We've all heard about the Affordable Care Act and the changes in our economy. All hospitals are having a tough time, and especially the small ones. So thank you, John. We are making some transitions. We're converting our local hospital to a federal designation called a Critical Access Hospital designation. That designation will not change any of the services that we currently offer,
Okay.
all the same services, but will improve our federal funding through the Medicare program, close to almost an additional $1 million a year
Wow.
in federal funding. So it's important and something that we're going through right now. And speaking of the Brenda Boss and the facilities, it is a beautiful building. Your viewers, the entire community is going to be very proud of this new building. If you haven't seen it already, we invite the entire community to come. This is for the entire community. Anybody can use this building. It's beautiful, and I think you're all going to enjoy it.
Now, when you say anybody can use the building, that doesn't mean, because I've heard people saying, well, who's this Brenda person? She's building her own hospital here? You know, no, but it's for, what do you mean anybody can use it? What are we planning to have going on in that building itself?
Thank you, John. The Brenda Boss Family Resource Center, of course, old-time residents, Noel, you, others know Brenda Boss and the
Now
Boss
he's-
family
Now he's calling us old timers.
extremely well. Brenda Boss was a mover and shaker in the community for many, many years. That was the driving force in building our hospital, which next year will be 40 years old.
My goodness.
The Bear Valley Community Hospital will be celebrating its 40th anniversary next year. So Brenda Boss, we're honoring her. This building is it's a clinic building. We are going to have doctors and nurse practitioners, and our grant program, the Mom and Dad Project, is going to be in that building. So all Dr. Dennis Carden, family nurse practitioner Sam Sum, other well-known providers in the community will be in that building. The reason I say it's for the entire community is because regardless of what your insurance may be, Doesn't matter if you're Kaiser, Blue Cross, Blue Shield, it doesn't matter. This building is open to everybody. Even though we are not a Kaiser provider, we take everybody. We will take anyone for a fee on time of service, a discounted fee of $30. Anybody from the community can come and see a nurse practitioner at our facility.
Wow.
It beats the price of gas driving down the hill, and you can see one of our fine providers.
Very good. And you're doing a lot of interesting things like telemedicine, which has been in, oh my goodness, Time Magazine. Everybody's talking about this, and it's really providing some pretty high-end consultations from people that are on the other side of the world.
Absolutely. It's the future of medicine. The future of medicine, because of the shortage of providers, shortages of doctors and nurses, what we're finding, not only in the smaller hospitals, but in the bigger hospitals as well, that specialist doctors are able to see more patients by utilizing technology. And telemedicine is, as you refer to it, in the context...
I'm sorry, was that the wrong thing?
No, it's right.
Oh, okay.
It's right. I just want to explain it to your viewers.
Okay.
Telemedicine, in that context, is a specialist provider utilizing computer technology to evaluate our patients by visually eyeballing them eye to eye, utilizing flat screen monitors and cameras. And
well, and there's a practitioner in the room as
there
well.
is.
So
There
I mean,
is.
it's like a second pair of hands.
Well, exactly, and the technology actually includes a stethoscope so that the provider on the other end, utilizing their headset, can hear the heart and can talk to the doctors and nurses and look at the test results and say, this is how I advise. The cardiologist, who may be hundreds of miles away, this is what we ought to do for Mrs. Smith right here in Big Bear Lake.
Wow. And that's,
You know, another thing that we have that you rarely bring up is we have a 24-hour helipad. And this is an amazing helipad. I've flown into it before. And being a helicopter pilot, I know it's not easy getting up here sometimes when we have lower clouds and things, but they manage to do it. And if you have a trauma patient that needs any one of the great hospitals down below, whether it's Loma Linda or Cedars, wherever it might be, Reagan Center, the helicopter can take you down there in 8 minutes. And it's great to have that right in the Big Bear Hospital.
sometimes you can't get cross town in 8 minutes.
I mean, that's exactly right, Noel. Thank you for that. Yeah, our hospital is the gateway to all the services that our visitors and residents need.
Now, not only are you doing that with the Brenda Voss, but the hospital's going under some changes. You've got some new CEOs and this type of thing. It is so hard to keep up with what's going on in your own backyard, let alone your backyard. So, how are you getting the word out to the public about what these changes are, what they might mean to us, and do we have any say in what's going on?
And I appreciate that, John. And yes, of course, and I appreciate your support, but my vision and my goal as CEO of the local hospital is to be out in the community, much as Liz said a couple minutes ago, being accessible to our community, and as one way of being accessible, we have set up a series of town hall meetings. We've had 2 of them already. The first one was at the Christian Center in Big Bear Lake. The second one was at the Methodist Church on the North Shore in
the next
Big
one's
Bear
still
City.
coming up.
And the next one is next week. So there's still time for your viewers to attend our 3rd town hall meeting, which will be held at the Big Bear Christian Center on Green Spot in Big Bear City. It's going to be Thursday night, November 21st, beginning at 5:30 p.m., going to 7:30 p.m. And the purpose really is to communicate, to get the word out about what's new at the hospital, what we're doing. We're very willing to talk about the Affordable Care Act and how it affects our local residents, and to answer any questions. But the number one goal, as we're calling it, is a listening tour. We want to hear from the residents of the Big Bear Valley in what they want from our hospital and what their questions are.
Okay. Well, I was at the Financial Summit, which
Yes.
you did again this year, which
Yes.
updated everybody on on the numbers and how we're doing there financially. And also, I attended one of your town hall meetings.
Yes.
And it is a pretty wide open forum. You were fielding questions on everything from, like you said, the Brenda Boss to what's going on with healthcare. And one of the questions, not to put too fine a point on it, next year in November, I think it's November or maybe June, we have another election coming up to reinstate the existing, is it tax?
Yes, parcel tax.
Parcel tax.
For the past 20 years, the local citizens and property owners in the Big Bear Valley have supported our hospital through a $45 per parcel per year parcel tax, which brings in $1 million per year,
Right.
a very necessary funding for our hospital. That parcel tax is due to expire in 2 years, and so you're right, John, that we are anticipating that we will have a parcel tax election to renew the tax, and likely going to be during the primary election in June of 2014.
Okay.
So part of our listening tour and our communication is to ask people to support our parcel tax and support our hospital.
And again, not a new tax.
No,
And it's not, you're not raising it?
no.
It's staying at $45
$45
a year per parcel.
Been the same $45 since 1995.
That's half what my sewer is. It's like a third what, I mean,
It's
it's next to nothing.
It's a cup of coffee at at any of our local fine establishments once a day for a month.
Oh, okay. He's gonna get one cup of coffee, $45. Wow. But and going through at the financial summit, it was pretty clear to me that if you lose that $1 million,
Yeah. Yes, we're on a fine line,
Yes.
and the hospital has had a difficult year, as it has been a difficult year for a lot of businesses in our country, and so that the money that is brought in by that parcel tax is absolutely essential, critical funding for this hospital, and if we were to lose it, the hospital would be in jeopardy. I mean, I guess there's no other way to put it.
well, let's hopefully you get the message out there. And one more time, before we do some commercials here and things, yes, we do. The booth is arguing with me. Silly boy. One more time, the town hall meeting.
Town hall meeting, Thursday, November 21st at the Big Bear Christian Center in Big Bear City.
Okay, and the spaghetti dinner?
Spaghetti fundraiser on Wednesday, November 20th at the Old Country Inn. It's starting at 12 noon and going till 9, $6.95 for all-you-can-eat spaghetti.
Wonderful. And if somebody has questions, they can stop by the hospital and...
My door is always open.
Very good. And they have a wonderful website with the Pink Gloves video and some videos of the Financial Summit, and that is?
bbchd.com.
Very good. And speaking of .coms...